Well, my friends, that was a Fifth of Beethoven by Walter Murphy and the Big Apple Band. Well, that wraps up our 10 in a row here on Nurse 110. Now let's take a commercial break.
Now, a word from our sponsors.
With the outbreak of the H1N1 virus, otherwise known as the swine flu, we are in desperate need of community health nurses. This flu is one that does not differentiate between race, social class, or health. Nurses are needed throughout the country to help combat this virus. There are job openings in multiple areas throughout the community health area. We are now hiring for 2 positions in the local community of Northern Napa County. We need public health nurses and home health nurses. The public health nurse will provide assistance to all people of our community. They will go out to local schools and teach kids and teachers general infection control techniques while also assessing them for signs of the flu. The public health nurse will also attend local community events and other social events, providing education for the public. We will also need nurses stationed in the low-cost clinics to help with the overwhelming amount of people seeking medical advice. The nurses in the clinics will be on the front lines of our fight against this virus. The other position that we have available is for a home health nurse. The home health nurses work with the patients when they have gone home from the hospitals or patients that have tested positive for the virus at our local clinics. The home health nurse will provide support to these patients by helping them cope with the isolation needed to prevent the spread of this virus. They will go to the patient's homes and provide in-home assessment of the patient's risk for hosting the infection. They will also educate the patient on general infection control and teach the client how to minimize getting a secondary infection. The home health nurse will also assess the patient to make sure that they are not getting any worse and ensure that they are receiving proper care, thus minimizing dehydration or other side effects of the virus that have shown to be deadly.
We need nurses with a current RN license to practice in the state of California. We also require a master's degree in nursing or a bachelor's degree with 5 years of acute care experience. You also must own a car and have a California driver's license. An amazing part of the job is getting to help make your community a healthier place. You get to provide nursing services to families in the community and also get to help establish health priorities and plan programs to meet health needs. You get to advocate for clients and families and set up health screening and education. You also get to link clients up with services that they may need. Home health nurses need to be a little bit of everything for their clients. Communication and relationship skills are key components. You not only address the patient's medical needs, but also their psychological and daily needs. We need self-motivated nurses, willing to work with diverse populations and keep patient confidentiality.
You might be wondering, what are the benefits of this position? To start off with, you get the benefit of being able to talk and being with patients in the comfort of their own homes. You also get a flexible schedule. The monetary benefits include a salary that starts at $23.70 an hour, depending on experience. Benefits also include health, which is provided by Anthem Blue Cross PPO Network, and also dental, provided by Delta Dental, and vision care. Work schedules are flexible, with some shifts needed on the weekends and in the evenings. The biggest benefits of all, though, are the opportunity to have a job that you love, being able to spend one-on-one time with patients. For a home health nurse, that consists of being in the patient's own home. And for the public health nurse, you get the benefit of helping the needy.
The day of a home nurse and community nurse is shorter and you'll be more active in the town that you live in. When the building of the hospital you work in get to be too white or too sterile and maybe the walking of 12 to 14 hours a day are getting hard on the legs, the environment of a person's home or the simple setting of a school office room, and since both are a more familiar place, it is often where the care is more dynamic and refreshing. Sometimes hugs are even given to the nurse for figuring out something small, and getting to know the patient is a lot easier. To find out more about community health nursing, please call 041-931-7446.
And now, let's hear a testimonial from Glenda, a home health nurse with 15 years of experience.
Often days I'm running around and in and out of my car from 8 to 2, and there's hardly any time to get a meal squeezed in. If I do stop home to get a bite, it doesn't last longer than 20 minutes. But the people are wonderful, and you really get to care for the individual in the comfort of their own home. Some days are longer because things have to be sent to labs, or there's a snag in the insurance, or even meds are on back order, so plan B. It has its negatives, but remember this: your worst day in the home health is still 5 times better than your worst day in the hospital setting.
Are you tired of wearing the same old scrubs day after day? Do they make you feel blah and needing some more excitement in your life? Well, get a look at our new line of Hylia scrubs. With their bold, flattering look, you will be the talk of the clinic or hospital. This look is going fast, so run into your local scrub store and ask for the Hylia section.
And welcome back to Nurse One Tan. For all of you community health nurses out there, I'm playing Electric Fever by Dada.
Thank you for listening to our podcast. If you want to find out more about community health nursing, please follow the provided link to the website. And if you still have questions, let us know so we can help you find the appropriate resources.